Every month I'm vaccinating 1,200 immigrants, Spanish speakers, and I see my community being left behind. I want to organize events where my community have access. We talk a lot about equity, but I feel that we don't walk the talk. So today is Vaccine Sunday. I speak in every church and talk about the myths. Una de las preguntas más frecuentes, oiga, que la vacuna mata. No, no mata. And I do say to my community, no, misinformation and ignorance is going to kill us. Entonces, si no lo quieren hacer por ustedes, háganlo por su familia. Equity is still not there. I feel that we're working very hard on this. The state, CDPHE, I have to thank them. They're trying their best, their hardest to be where the community's at. A lot of people ask me, when is this gonna end? I don't know when it's gonna end, but I know that I will not end and I will not stop till the last Latino in Colorado get vaccinated.
There is such a tremendous health disparity in our nation between people of color and the majority. I'm always trying to preach and teach to people in my community that we need to do whatever we can do to live, to prosper, to gain. And you really can't live, and you really can't prosper if you're dying.
Since the beginning of the vaccine season, my sister Andrea and I have been running and leading clinics through CDPHE as part of their Equity Vaccine Task Force. This is probably about our 100th clinic that we have done in that time frame. We've vaccinated close to 60,000 people. Some of the things that we do to make sure that everybody has equal access to the vaccines is we make sure that we get into their communities, we go where they're at. We also make sure that we provide vaccines to anybody and everybody regardless of their insurance status, and we make sure that we provide multiple translators of lots of different languages so that they feel as comfortable as they possibly can in a situation that's not always comfortable.
Good girl, good breathing, awesome.
Another way we've been able to reach people is to do it on a Sunday. You know, a lot of people don't have to miss work, take their kids out of school, nothing. They can just show up and get vaccinated.
We're here at an apartment, at an area that is in much high need. We're bringing vaccines to them in a fun way with Santa, with a clown, with a jumping castle. We're making this a vaccine party, and that's how we're attracting all communities. Just in the first hour, we have vaccinated more than 130 children between the ages 5 to 11. Feliz Navidad, mi niño. Access to care should look like providers working with the community. Then we will build that trust between community and providers. But providers need to go above and beyond their work duty Monday through Friday, 8 to 5 p.m. Most of these community members work 2-3 jobs. Okay, give me 5. Let's all unite and transform communities through vaccines.
We have been able to pull off a very successful COVID vaccination clinic. As an African American woman, and also as a provider, I have seen firsthand the blatant attack that COVID has had on people of color, and specifically Black and brown communities. So it's important that we end this pandemic.
We wanted our community to have access to this vaccine. We wanted those who are often left out of the equation, particularly for things like this that so often are limited to the privileged who have access to this. We wanted those people who would have otherwise been left for last, if at all, to be able to be in the forefront. We're looking at the opportunity to save lives, and that's what this is about.